Hey everyone, welcome to my channel. My name is Lily. So I was reading an article this morning by the Scohan Clinic in Newbridge, and something caught my attention. It's about an eating disorder and how to tell if your friend has an eating disorder. But listen as I read. Here is, how do I know if my friend has an eating disorder? Does your friend talk about food and weight all the time? Your friend exercises more than anyone else you know, even when they are feeling tired or unwell. Your friend avoids being around when everyone else is eating, such as lunchtime in the school, college, or cafeteria. She doesn't join in anymore if you go for a meal at the weekend. Your friend starts to wear big or baggy clothes all the time. When you eat with your friend, she cuts food into tiny pieces or moves the food around on the plate instead of eating it. Is your friend proud of how little she is? Is your friend proud of how little she eats? Does your friend go to the bathroom a lot, especially right after meals? Have you heard your friend vomiting after eating? Your friend always talks about how fat she is, even though she has lost a lot of weight. Is your friend very defensive or sensitive about her weight loss, or eating habits? Does your friend take laxatives, steroids, or diet pills? Does your friend have a tendency to faint, have bruise easily, is very pale, starts complaining of being cold more than usual? You notice they say she a lot? I want to talk for a minute about how men deal with anorexia too, not just women. You know what I'm saying? I think we need to get in a community that understands. And I understand that it's more females than males that deal with it, but we still need to understand that males do deal with it. And I wish that a lot of these sites would add, say they, instead of he or she. Just put they. Do they cut their food into small pieces? Now, what's interesting is a lot of these things that I did read about actually seem like someone we see on YouTube a lot. A couple different YouTubers, always wearing long sleeves, look very pale. A lot of different things that I just read. How do I talk to my friend about eating disorders? If your friend has some or many of the symptoms listed above and you are worried, it is a good idea to talk with them about your concerns. It is a sensitive subject to discuss, and your friend may feel ashamed, confused, or be very secretive about her eating habits. She might be defensive or even angry when you bring up the subject. The most important thing is to tell your friend that you care about them and want to help and support them. Try not to become frustrated if they don't listen to your advice. It is normal for people with ED to take a long time to come to terms with the fact that they have a problem. How do I get help from my friend? If your friend is willing to get help, offer to go with your friend to a GP. A GP can assess your friend and refer her to counselors and other health experts who can help. Your school nurse or college counselor would also be a good start. It is very important to have a support system. It is very important to have the support of experts because eating disorders are very serious and rarely get better on their own. And that's very true, because when we deal with it, we don't see it. Your friend will be given the right treatment for their individual needs. This may involve seeing a counselor, psychologist, or psychiatrist to talk about their eating disorder and find a way to overcome it. People with eating disorders sometimes need to go to the hospital, but others may be treated while they continue to live at home. There are also many good support groups where your friend can meet other people who have eating disorders and talk about their experiences. Friends are often welcome to attend groups, and this can be a very valuable way of continuing to support your friend. I'm sure my friend has an eating disorder, but they are in denial and won't get help. What should I do? Eating disorders are a very serious illness which can have serious effects on sufferers. If you are very concerned but your friend denies she has a problem, you should talk to an adult. This may be difficult and feel like betraying a friend, but if your friend does have an eating disorder, he or she needs help from a specialist and experts. Perhaps you can talk to your own parents about the concerns, or your friend's parents. Your school or college counselor is there to help you with any problems such as eating disorders and would be a good person to speak to. And they give a lot of different advice about what to do and where to go. Says there's an outpatient clinic. We provide a clinic for people who are suffering from bulimia or binge eating disorder who want effective, proven treatment. You have the assurance that your treatment is provided by a service which has been rated outstanding for the second consecutive time. This outpatient service allows patients to visit Newbridge House for weekly appointments with our consultant clinical psychologist for treatment. Refined specially, they got their words a little messed up here, specifically for bulimia and binge eating disorders. And then you can click to go to some of their different programs. There's a bug in here aggravating me. I don't see these bugs all day, and then as soon as I start trying to do a video, it's like they come out of nowhere. Okay, so they do have men and eating disorders. And I just clicked that. It has been commonly stated that 1 in 10 men have anorexia, bulimia, or another type of eating disorder. Recent figures from the NHS Information Center suggested the real figure is actually much higher, with 700,000 men being registered as having an eating disorder, a quarter of the total number of people affected. While it is difficult to be exact in terms and numbers, it is clear that there are many men who hide their eating disorder and do not seek help. Many men feel anorexia or bulimia are a female condition, and this shame is combined with the guilt and secrecy common to all eating disorders. Eating disorders in men typically develop between ages of 14 and 25, but people can also be affected at other ages. And then it talks about how eating disorders, develop in men. Like for an example, sudden weight loss may seem like the result of a training program for a sporting goal for sports. Weightlifting, family difficulties, trauma, low self-esteem, personality factors, genetic, low self-esteem, stressful life events, childhood trauma. There are a number of different reasons why it develops in men and women, boys and girls. Eating disorders in men have many of the same causes as eating disorders in women. And it's so sad. It really, really is. It's nice to see that this place offers help to men and women, though. That's very good. But the name of this, I'll try to enlarge it so you can see. Can you see that? Scohan or Shohan Clinic? I think it's Scohan Clinic in Newbridge. And they offer help. I just wanted to read on that a little bit. There is a hotline number. I'm going to try to pull it up right now. The National Eating Disorder Hotline. And I'll give you that number before we get off of here. Okay, let's see here. I think they make it so hard to find these numbers on Google. I don't understand why, if I ask what the number is, why Google doesn't just tell me the number. It gives me all these articles and websites. Okay, like bulimia.com, eating disorder hotline, and then I have to go to the website to get the number. And this is what, deters a lot of people from getting the number, because they have to go through so much hell to get the number. I mean, yeah, that sounds like it's just a tap of a button, Lily, but still, someone's mind can change within a split second. You know what I'm saying? So that number should be right there on the front screen. Bam. Hey Google, what is the National Eating Disorder Hotline number? And it pulls it right up. Like, because I can type in, do onions go with garlic? And it pops right up.